It's 8:35 and it's great to have you with us on GBN Television, Classic Radio, www.gbn.gd, and on our social media platforms. I'm Odette Campbell. This evening it's time for another edition of Beyond the Headlines. Last week I did promise that we will look at COVID-19 vaccinations, and I'm delivering on that promise this evening. Our panelists this evening are our Minister for Health, the Honourable Mr. Nickolas Steele, the Chief Medical Officer, Dr. Shawn, and Dr. George Mitchell of the COVID-19 Committee. Gentlemen, welcome.
Good evening, Odette, and good evening to all of your viewers and listeners out there. It's indeed, as always, a pleasure to be on your program.
Great. And having established the protocols, we ensure that both gentlemen are 6 feet apart. The minister wanted our permission to remove his mask, and so we have granted permission because we did get the measurement and they're 6 feet apart. So, Minister, you now have my permission to remove your mask.
I know you want to see my face, but Dr. Mitchell and I have been consistently preaching the rules and protocols. So you'll only get one of us taking off our mask at any one time.
But we had the measurement taken, Minister, and the 6 feet does exist.
we are promoting. Good night, listeners. Good night, everyone. It's a pleasure to be back. And yes, Odette, we did the measurements. We are 6. All the minister is very tall, so it may look slightly less. But because we've been preaching the message for the last year or so, we wanted to make sure that we actually did it in practice. So I am without a mask. Although we've been vaccinated, we wanted to make sure that we had the right messaging out there as well.
Got you. Messaging is very important. So let's cross first to the Chief Medical Officer, Dr. Shawn Charles. The last time we were here, we were looking at updates and numbers, trying to get the economy kick-started again. Now we're at the stage of vaccination. So before we talk vaccination and numbers, let's do a review, a rewind on numbers as far as COVID-19 in Grenada is concerned. Dr. Charles, it's great to have you, as we did mention.
All right, good evening to you. Good evening to all fellow panelists and to all our viewing and listening audience. So I am pleased to report that as of today, total number of confirmed PCR confirmed COVID-19 cases in Grenada remain at 148. We had 147 recoveries and 1 death. We have had no new cases since 21st of January, and we have completed in excess of 21,800 PCR tests. At present, we have 166 persons in quarantine, and these are travelers who are at various stages in the quarantine process. In total, we have had overall 6 persons hospitalized, and of course we have no one in hospital and no one isolated at present. So that is, in a nutshell, our status with regards to number of cases of COVID here locally.
So you had 6 persons hospitalized. I've been curious to know, hospitalized because these were people with underlying health conditions, or these people who had near-death experiences?
These were people with moderate to severe disease, and yes, they had underlying health issues. And all of these hospitalizations occurred in 2020.
In 2020. And of course, we had 1 death, and there was that press conference that never materialized, and there's been promise of an investigation. Any update on that? Any information that you can share with the public concerning the 1 death that we had?
All right. So remember, this review was to look at how we addressed our first death and how we can improve. All right. And that review process took place. We had a sit down and a chat with the physicians. We went through in a chronological manner the from the case arriving to the case to his demise. So it was a process where we examined all of our systems and we looked at how we can avoid such things in the future. So that was really the emphasis of that review, to see how we can improve in the event that we do get very severe cases again in the future.
Let's go to the Minister. Minister Steele, we know you take the tough questions. Somebody dropped the ball somewhere, according to a family member. Would you care to comment on that?
No, I don't think the case should be discussed in public. I think that the family has lost a loved one. I have personally reached out to the family and been in communication. Others of my team have done the same. And I think medical issues with any individual, and particularly any issue that leads to the death of a family member, is a private matter. And from where we stand, from where I stand in the ministry, we are and continue to be open to dialogue and discussions with them in any area. But it will not become public by our doing, and we will make every effort to make sure that their privacy is respected.
I was really asking from the Ministry of Health review if it was found that someone dropped the ball, not necessarily asking you to comment on the family member or anything related to the family discussions that you might have had.
No, the ministry on the whole has an obligation, wherever there is any hint of wrongdoing or so, that we have to hand that over to the Director of Public Prosecutions for them to make a decision, and to the Medical and Dental Council for review or so. So in any instance, there will be that action, that principle, that rule will be followed. The fact of the matter is, Odette, just before coming on to this program, I was looking at a very somber occasion being held at the White House, where they are commemorating and recognizing 500,017 deaths in the United States. So, as we have said from day one, COVID can and does lead to death. And our health team has done their best, provided yeoman service, gone above and beyond with the limited resources that we have as a developing country. Our numbers as low as they are, and we'll continue to work as best as possible. That is separate and apart from the emotions and the feeling of loss of any family. And I think any family has a right to want to or believe or wish that something more could have been done or should have been done or may have been done. But when you are dealing with a disease like COVID-19, regrettably, sometimes it gets to a position where there's nothing more that could have been done.
Okay. So, Dr. Mitchell, it's almost a year that Grenada started grappling with this. We remember it was the middle of March when the alerts went out and action started to kick in, where we had, certain measures being taken. You had the lockdown, and a year later, almost. What are your thoughts? We know that you headed up the committee. You're still there in the midst of the battle. What are your thoughts on how far we've come, Dr. Mitchell?
Okay, so Odette, maybe I start by saying thanks again. All the listeners, not really that we have done painstaking job, full of sacrifice, and I'm going to sit here and Dr. Charles Press.
Doc, we need to ask you to speak up a little bit. If you're hearing me, Dr. Mitchell, we need you to raise the volume a little bit.
Yeah, just speak up louder.
Okay, so am I being heard better now?
Yes, you are.
Right. So I'm saying that since the beginning of the pandemic, without any attempt to blow any horns, there's been a lot of sacrifice and a lot of you know, painstaking work to get where we are at this time. And a year on in the pandemic, we are, you know, we are seeing some light at the end of the tunnel. But the issue is that we're not about to take anything for granted. We have said as a team that this is a war that we are fighting and that we have won several battles. We have won good battles, but there are more battles to come. The war is not ended. And as such, we have to remain focused, even as battle weary that we may seem to be, but we have to continue to fight. And, you know, we're talking vaccine tonight in the main. And, you know, I like to describe it as one of our main weapons, one of our main arsenal in the fight against COVID-19. So we have done well, but we would not relent in the fight against COVID-19. And as such, and I hate to want to sound the horn this early in the program, but, you know, we need to remain focused to continue to be on the victory path. So that is basically, in terms of an opening statement on the question you asked, that I would like to say.
Okay, let's go back to Dr. Charles. Dr. Charles, you mentioned that there are no known cases. Should we be resting at ease in Zion as a result of the stats that you shared?
No. In fact, I think we should be doing the opposite, because I am sure that we are all aware that in countries all around Grenada, there is intense community spread of COVID happening. We can look to the north, to the east, to the south. We are surrounded. Every time a plane lands here in Grenada, it comes from a country where there is community spread of COVID-19. So we have to be on our guard. We have to continue to be vigilant. We have to continue to adhere to the public health measures that are put out there to ensure that our situation doesn't change and we don't suffer a reversal and end up like many around us. So it is this time when we should be looking at consolidating what we have, protecting, eagerly protecting the gains that we have made to ensure that our community remains safe.
So, Minister, we saw yourself and Dr. Mitchell taking possession of COVID vaccines a couple of weeks ago. It was around the 10th or 11th of the month. And would you like to share with us how many doses have we received and what's the plan for distribution in terms of people getting vaccinated? We know you started with the healthcare workers. You took the first jab.
Yes, we received 2 weeks ago 6,000 doses. We continued with our vaccination plan as originally dictated, which was that the first doses would be for our frontline workers. First and foremost, our healthcare sector, and even there, first individuals to receive within the health sector would be the community health nurses, the A&E, all of those who are actually frontline dealing with people, the first responders. Remember, our community health nurses are the ones that have tested every single individual who has been tested in Grenada. So every single individual who has tested positive has interacted with one of these individuals. Our immigration officers, our customs officers, those at the travel desk at Morris Bishop International, Port Authority, those dealing with any of our vessels coming in, our police. So we needed to make sure that we gave all of them, while the vaccine is voluntary, we dedicated an entire week for them to come at their convenience, those who saw it fit and were ready and were willing to take that vaccine. So that opportunity was given to them. At the end of last week, the entire week dedicated to them, there were 394 vaccines or doses given at that point. This week, as of this morning, Monday morning, at approximately 9:30, we started offering the vaccine to our other level of frontline workers, those in the hospitality sector, those who are working in the various hotels and hospitality accommodations that are dealing with people in quarantine. So they would have interacted as well with positive cases. So they are at high risk. So they came in, and we saw within one day, we moved from ending Friday with 394 to ending today with approximately 649, Dr. Charles, somewhere there, as the total amount of vaccines, so almost doubling. And then based on the information so far with respect to those who have expressed an interest, desire, or who have been scheduled to come in tomorrow, I'm hoping and expect that we will again see similar numbers tomorrow. In fact, possibly even more, even higher numbers. These individuals recognize, having been placed at risk themselves, but I think specific to the hospitality sector, they have been either out of jobs, they have been on rotation, they've taken reductions in salaries, they have seen that their workload has reduced significantly. So they understand that in order to get back to any form of norm, pre-COVID norm, or to get to the post-COVID reality, we need to be vaccinated. And I am really heartened by the response we've received from them. And we are looking forward to moving to our next stage, which would be that individuals 65 and over and individuals with comorbidities and at high risk would then be vaccinated as well. So we've put in a level as best as possible of insulation for those who interact with possible COVID cases. Then we put in a level of insulation as best as possible for those who are at high risk should they get COVID. And then we roll it out to everybody else to get to that critical level where we can say, based on the size of the population we have and the numbers that have been vaccinated, we can get back to business as normal. The borders can open, people can freely flow in and out. We can start talking about Carnival or Christmas or the sporting activities, or at the weddings at large scale, of parties celebrating birthdays, all of these things. The taking off of the mask, and they're moving on to normal. That is what we are aiming to get to, and that is what the people who have come forward and taken the vaccine, that's what they recognize. This is the path, and we need to see more. As much as I am heartened by the numbers that we got today, I'd like to see more. I'm looking forward to longer lines and putting more nurses and doctors there to do vaccinations, having to request that Dr. Mitchell himself or Dr. Charles to get down there and help them vaccinate people so we can do this as quickly as possible.
But Minister, let's look at...
It's a good sign that we're seeing, and we hope the trend continues.
Minister, let's just, as a producer, to go back on that shot that we were looking at. I had a concern about that crush of people, no social or physical distancing there. If the producer can help us look at that, Minister, was that correct procedure today?
But Odette, what you saw, I'm sorry, but I think you're nitpicking there, because what I see there, everybody wearing the mask, persons waiting to get that added level of protection. And in waiting to get that added level of protection, they are wearing the appropriate levels of protection. That shot even more appropriately shows it there. So in order to get individuals to be vaccinated as quickly as possible, you are going to have to line up. But they are all spaced out, they're all sitting, waiting. Most of the people that you're seeing sitting close together are families that have come together to be vaccinated. But I was there personally. You were looking at pictures. I was there personally. And I saw individuals following the protocols. maintaining their distance. So you see, I agree, a picture is 1,000 words, but the reality is being there on the ground.
So may I come in, Odette, if you don't mind? I was there from about 12 o'clock until the end of the day. Are you hearing me?
Yes, I am. Go right ahead.
Odette, are you hearing me?
Yes, I am. Go right ahead.
So I was about to say that I was there on the ground. Yes, I was there for about 4 hours today. And indeed, in the majority of cases that you saw any semblance of bonding, were people, either families or co-workers that were there and, who would have existed in their spaces for weeks and maybe months. But in the majority of cases, persons did take their protection, did wear their masks, and they were actually happy to be in the line. And I had the opportunity, I had the pleasure of speaking to many persons today, and it's really, really heartfelt to see how many of them took the vaccine, and I encourage them, even though they were privileged to be frontline workers, to encourage their families as well. And I could see no hesitation on their faces in wanting to do so. As a matter of fact, one gentleman asked me and said to me, where is the camera? I want to be on the media encouraging, I want to be an advocate for vaccination. And I felt extremely, extremely proud to be a Grenadian at that particular time. So it was well, augurs well for the uptake. Of course, there could be no less than more encouragement in the process going forward. And, people are recognizing that it is what we need to do to be able to come back to any sense of normalcy.
Right. So, Minister, you accuse me of nitpicking, but a picture paints 1,000 words. And when our cameras were there today, there was this bundling. And all we'd say is lesson learned. So tell the team tomorrow at Radisson that they need to work on physical distancing. Let's go to Dr. Charles again. Dr. Charles.
Let me correct that. I'm not criticizing you for nitpicking. I think it is necessary always to find issues in any of the systems. And that is why the rollout has been phased. That is why from day one, we didn't start with everybody as quickly as possible. It is to make sure that we pick up on these issues. So one of the lessons from today, most definitely, is more people to register so that there's less lines, the scheduling of people, which we knew, but we didn't expect such a large turnout today. And then the other is multiple sites. We have people in the countryside. We have people in St. Clair's. We have people in St. Andrews. We have people in St. Barb that they want to come. They are possibly workers within the frontline section as well. But the part of the next phase also is to go out there as well. So let us disperse the vaccination centers so that the crowds don't come together as much. But it was necessary to begin this engagement in the South because the majority, no one can argue, the majority of our hospitality frontline workers are working within the South and are currently on a daily basis in the South.
Thanks, Minister, for the clarification. Let's go to the CEO, Dr. Charles. Dr. Charles, we have chosen AstraZeneca. Why that choice and not another one of the vaccines that are available?
Well, different reasons. One of the key reasons being that AstraZeneca is the vaccine that is most suited to our environment, to our climate. AstraZeneca vaccines use the same cold chain requirements for all the routine vaccines that we currently administer in our immunization program. Requires temperature of 2 to 8 degrees for storage. So it's very easy to store and distribute, as opposed to the others that are available, such as Pfizer, that require ultra cold chain, which is about minus 70 degrees Celsius, which is quite cold, and Moderna. But secondly, the availability of the other vaccines, how the accessibility of the access to the other vaccines is not there. You may be aware that these companies have signed agreements with the developed world that really tie their hands. They are not able to export vaccines to countries like ours, especially with our small populations, until they fulfill all of the needs and all of the requirements of the larger countries. The process of distribution of vaccines against COVID have been quite inequitable. All right, there has been little solidarity until recently that has been demonstrated with countries like India and our brothers like in Barbados and Dominica, who are sharing. Right, so this has been a big issue with regards to access to the vaccine. So one, access to the other vaccines is not there. Right, it's not there. We do not have access to them. And two, the AstraZeneca vaccine is a safe and effective vaccine that meets our local requirements.
Okay. Minister, there's a question on the social media feed about did the government follow due process in contracting this vaccine? How much money is it costing taxpayers?
Well, these vaccines, the 6,000 that we have received, have been donated by the government of India to the region. These are the first set. The second set and third set of vaccines are a combination of WHO PAHO coordination, which some of it we have to pay for, and some of it is also donated. We are not sitting back and waiting for handouts with respect to vaccines. We do recognize that the way out of this pandemic is by vaccinating your population as quickly as possible. And the first step of that is access to the vaccines. So we have pushed every button, pursued every lead to get vaccines collectively, as well as individually as OECS CARICOM countries. And you will see more and more rollout, and there is also discussion. So it is not an impossibility. It's probably most likely that there will be additional vaccines and there's different manufacturers also that would be offered as we move forward, not just by Grenada, but throughout the region, as you are seeing in other countries as well. Europe first had Pfizer, BioNTech as their first vaccine that they brought to their population. And then there's AstraZeneca and their discussions now in Europe for them to have Sputnik, the Russian vaccine, or maybe Sinopharm for some European countries, the Chinese vaccine. It is to make sure once a vaccine it meets the standards for us, WHO, Pan American Health Organization, or any of the recognized entities that we have clearly said, then it is a vaccine that we pursue. But in discussions beforehand, we are very much aware of those that are close to getting accreditation or so. And we begin discussions with them as best as possible to get allocation so that once it is approved, we can purchase, we can pull the trigger, so to speak, and have that allocation delivered, as we have done with AstraZeneca and will continue to do with any of those that meet that criteria.
Dr. Mitchell, can I ask you about legislation? We have somebody on social media saying, as part of the requirement to access the vaccines through the COVAX facility, member states were required to enact indemnity and liability legislation. Has the government of Grenada done so, or do these legislation already exist? Dr. Mitchell, can you answer that?
Well, I think Odette is unfair. I'm the legislator. I'm the parliamentarian legislator.
I would actually answer the question by saying to Odette that as ex-chief medical officer, you need to maybe direct that question to the current one, of course, and the Minister of Health right here. But no, I really, I'm really happy that you went to the legislative part of it, because I think it's an important question to ask.
Well,
so, Minister,
I would say that I've heard Dr. Charles answer that question previously. So I will defer to him in the beginning, and if he misses any of the points, I don't mind taking it up. But I agree with what Dr. Mitchell has said. Dr. Charles is the current Chief Medical Officer, and as such, with respect to those issues, he is the first line that we should all go to.
I missed my cue, so Dr. Charles, I'm coming back to you.
But it's okay, Odette, we'll be fine.
All right, so there's an indemnity agreement that we are required to sign to access the vaccines. And even for the purchase of vaccines, there is an indemnity agreement that is included. And I think last time I tried to explain the reasons for this. The thing is, if there are large number of legal disputes for, let's say, minor side effects that are occurring in multiple countries across the world, this can hamper vaccine production. It can hamper vaccine deployment, because it means that these manufacturing companies have to divert large amount of research of resources defending legal proceedings in all parts of the world. So this has been recognized as something that hampers both vaccine development, vaccine deployment as well. So the need for an indemnity agreement has arisen. Now, the thing is, there are still avenues that can be pursued if there are legitimate issues that arise outside of vaccine, and those mechanisms are being worked on. So with regards to the indemnity, there is an indemnity agreement that we are required to sign to access the vaccines from COVAX. So,
Mr. Charles, the AstraZeneca, there seems to be some issues. Some people describe it as being the least effective. They're quoting figures as 67% efficacy. And we've seen, for instance, that Switzerland, they have banned AstraZeneca for all citizens as Europe declares war on the UK jab. And we have had cases where one study was, I think so far in the US, there are 501 deaths plus 10,748 other injuries reported following the COVID vaccine. That's separate, and we'll get to that. But with countries banning AstraZeneca, why do we have confidence in it?
Good. Let me say clearly, Odette, that we're not aware of any country banning AstraZeneca. I think you really need to read those articles thoroughly. What you have is countries saying that they are not using it. They are opting to not use it. Not that it should not or cannot or will not be used. And that is the countries that are doing so are countries that have choices of vaccines. And I have spoken personally, for instance, to the Minister of Health in Malta and other European ministers who have made that decision. And in general, they started with the Pfizer-BioNTech and had access to it and started giving their citizens 80 and over, then 70 and over, then 60 and over, the Pfizer-BioNTech. When the AstraZeneca came onto the market, it did not have that amount of information for individuals 65 and over. So they have opted and said simply, we are going to be using this vaccine that we have all the information on for the 65 and over, and we are going to be using the AstraZeneca for the under 65. In the case of the Swiss, they are saying that they are going to use a vaccine that they have with a lot of information as opposed to the AstraZeneca. In the case of South Africa, the only study done on any vaccine was AstraZeneca. And the South Africans found in that study that while there was protection from the variant that they had, there was minimal protection. So it still would give you symptoms of COVID-19, serious symptoms, not life-threatening, but serious symptoms. So they made a decision as a government who 90% of their cases are that variant. They said, well, let us pursue some of the other vaccines. But none of the other vaccines have been tested on the South African variant as much as the AstraZeneca vaccine has been. So there is still the possibility that the other vaccines will not be as, or will be similarly responsive to the South African variant. But a minimal protection, once we can get to the optimal level of vaccination of our population, we still are going to have that level of herd immunity, and we are still going to be able to protect ourselves from COVID-19.
So, Minister, you said that you needed to correct me on the subject that they've not necessarily banned it, but they have said that they're not authorizing it for use, and we could talk about nitpicking. But Switzerland has made a shock move not to approve the Oxford AstraZeneca vaccine for use in its rollout of COVID-19 jabs. The decision makes it the only country in Europe not to authorize doses of the Oxford-produced jab for use. The Swiss medical regulator claimed there was a lack of data to reach conclusions on the efficacy of the COVID-19 vaccine. Approval of the jab has been widely expected by many in Switzerland. That's according to the report, and I do not use hearsay or... Go ahead, Minister.
That's exactly what I'm saying. Grenada has not approved Moderna, Pfizer, Sputnik, or Sinopharm, but that does not mean that we've banned it. We have not approved Sputnik, the CARICOM region, or Sinopharm because we don't have the information that we require, which is approval from WHO or Pan American Health. But that's not a ban. That is just saying that we're not going to use it until we get a certain level of information from wherever we choose to get that level of information.
All right, so
that's why I'm saying that the headline, and it's not you, Odette, the headline itself is misleading in that giving the appearance that there is something negative about the AstraZeneca vaccine or any of the vaccines that a country might say, I'm using this one and not that one.
Got you. So just to make sure that we give a synopsis, Swiss medics said for the vaccine from AstraZeneca, the data available and evaluated to date are not yet sufficient for approval. In order to obtain additional data on safety, efficacy, and mutuality, there needs to be more study. I just wanted to make sure that we clarify that point. Let's take a commercial break, and we'll be right back on Beyond the Headlines.
What makes a strong team? Supporting each other, sharing successes and disappointments, learning from one another. Get a Be Better health plan from Beacon and get simple and affordable medical benefits so you can build a better team. Call 440-4447 or log on to beacon.co.tt for more information.
Do you know what time it is? You guessed right, it's detox time again. At Nirvana Natural Health Clinic, Detox Center, and Natural Health Store. Purchase our 7-day cleansing pack for only $500. Includes everything you need for a complete total body cleanse. Cleanse your blood, kidney, liver, and colon. This cleanse will help you lighten up and get rid of the excess. Also available are our special product detox combo pack for only $100. Try our single detox products starting from $40. Check us out now. Belmont St. George's, close to the Fall Edge area, or call us on 231-6642, 449-7753, or 418-7115. Nirvana Natural Health Clinic, Detox Center, and Natural Health Store. Detox, your way to health.
We are all essential in the fight against COVID-19.
At Courts, we're doing our part, and we encourage you to stay at home, stay safe, and shop online at www.shopcourts.com.
For added convenience, our Courts online customers will receive free delivery and get up to 20% off televisions, appliances, and homewares. Plus, if you shop with Ready Finance, you will pay nothing down for 60 days. Now, you can stay home, shop online, and save.
Remember, do the essential. Wear a mask, wash your hands, practice social distancing, stop the spread.
I'm reaching my dreams with GOT. They're the ones for me. I'm reaching my dreams with GOT. They're the ones for me. Since 1983, they've been serving the country, and we like all their financing, giving the people what they want, what they need, what they love. Come and join the family that's here for you all the way, from birth to graduation, your first job to your home, and your car through your golden years.
The GT Credit Union has been actively supporting nation building through its many sponsorships and programs, including Financial Literacy Quiz, Pass the Torch Calypso Program, Junior Cooperatives in Secondary Schools, CPEA, and the TAMCC Grants. The credit union has helped many people make their dreams come true. Let them help you with yours. You don't have to be a teacher to be a member. So what are you waiting for?
GUT Credit Union, it's where you belong.
Every action we take impacts the lives of others around us. The Grenneck Community Partnership Initiative, GCPI, has been working with Grenadian organizations to impact communities directly. Giving back to communities we serve is fundamental to the way we do business. And every year, more lives are touched across Grenada, Carriacou, and Petite Martinique. In education, sports, health, infrastructure, social services, and beyond.
Get Rubigas. Get cooking. Rubigas, clean, safe, and reliable LPG is the perfect solution for your commercial and everyday needs. For cooking at home or barbecuing, choose Rubigas LPG cylinders. Available in a variety of sizes from 20 to 100 pound cylinders. Rubigas LPG, clean, safe, reliable. Are you cooking with Rubigas?
Get Rubis, get going.
Welcome back to Beyond the Headlines. This evening, we're speaking with the Honourable Minister for Health, Mr. Nickolas Steele, the Chief Medical Officer, Dr. Shawn, and Dr. George Mitchell of the COVID-19 Committee. Tonight, we're looking at COVID-19 and the vaccination process. As we know, it has been rolled out across Grenada. Let's go to the Chief Medical Officer, Dr. Charles. Dr. Charles, can I ask you to, let's go through a rapid-fire testing question?
Well, yes, sure, but I really wanted to chime in on that last discussion, bit of discussion that we can have, because there are some topics that can leave confusion in the mind of viewers and listeners. And I believe that they need clarifying in order to resolve that confusion. And it was in regards to the headline that you read. Now, a headline like that does cause a bit of confusion, because considering that the AstraZeneca vaccine was granted authorization by the European Medicines Agency, it was granted authorization by the UK medicines regulators, it was granted authorization by the Australian medicines regulation, and it is one of 2 vaccines that have been granted emergency medical listing by WHO, one of 2 in the world. So one country that makes a questionable decision does not speak to the quality or the safety or really the efficacy of a vaccine. Remember, there was a huge public spat over this same AstraZeneca vaccine between the UK and Europe. Persons are motivated to make decisions for different reasons. And sometimes headlines are misleading.
Okay, so having cleared that up, Can I ask you some questions? If we could get like some short answers, and then we could go back into detail, right, in another round. So people are asking, do the vaccines change your DNA? Is that a yes or a no?
No.
And is immunity from the vaccine stronger than natural immunity from infection?
That is still being studied.
And did the vaccine clinical trials skip tests to be completed faster?
No, it did not.
How did financing aid the process?
Well, financing came from governments and the drug companies themselves.
How did finance, no, sorry, we went through that. Was vaccine efficacy only measured in symptomatic COVID-19 cases?
Correct. The outcome of the clinical trials were persons who developed symptomatic COVID-19. It did not look at infection. That is actively being looked at right now.
Can the vaccine give you COVID-19?
No, the vaccine cannot give you COVID-19 because it does not contain COVID-19. If I have allergies, can I still take the vaccine? Yes, you can still take the vaccine as long as you are not, you do not have an allergy to one of the specific components of the vaccine. If I'm pregnant or breastfeeding, can I still take the vaccine? That is still being studied because there were not maybe many pregnant women involved in the clinical trials. We do not have information, all the information on the efficacy and safety in pregnancy. However, this type of technology has been used to vaccinate even pregnant women in the past, and no negative effects in the mother or the fetus were discovered. Can you still transmit the coronavirus after vaccination? That is possible. It is possible that after vaccination, now the vaccine protects you from getting moderate to severe disease. So you will not fall sick enough to be hospitalized or even die, even needing to be ventilated and so on. However, it is possible that you may have what is called an asymptomatic infection or an infection with no symptoms, and you may pass that infection on to someone who has not been vaccinated or someone who does not have any immunity to the disease. Okay. Will we need new vaccines if the virus continues to mutate? Right, so it is possible that, like the flu vaccine, as the strain of the virus changes, it is possible that we may need additional boosters in the future. That is being studied. We are aware that each year a new flu vaccine is released based on the strain that is circulating. So it is possible that a similar need may arise. Thank you very much, Dr. Charles, for being very efficient with those answers. Those are burning questions that people submitted prior to the program, and I just wanted to be certain that I get as many people's concerns addressed. Speaking of concerns, let's go to a video excerpt that we did a week and a half ago, speaking with members of the public on their thoughts of vaccination and what are their disposition toward being vaccinated. I'm certain the producer can assist us with that piece at this time so that we get a feel, because not everybody is able to call in or even submit their questions on social media. So, Mr. Producer.
Over the past few months, Grenadians have been very vocal on the various COVID-19 vaccines that are now being issued in different parts of the world. This topic has plagued many social media platforms, citing the medical effects and its effectiveness. On Thursday, Grenada welcomed a shipment of 1,000 doses of AstraZeneca with the aim of rolling out the vaccination process by next week, starting with frontline workers. GBN sought to find out what is the mindset of the public now that the COVID-19 vaccine is at everyone's doorstep.
I find them thing of them is a money-making thing. They are the thing plan and they orchestrate the thing properly. So I will take that vaccine. We all have to dead. And if I take it, I go. If I won't take it, I go there. I would prefer to don't take it and then. That's my mentality. That's my belief.
Personally, I don't choose a vaccine. I can see some videos, man talking that kind of language and thing, the vaccine. I mean, you don't want 100%, So, personally, I wouldn't take the vaccine. I mean, I would. I'll drink bush tea and spice and thing.
I think that it is a good initiative, and You know, it would help prevent us from getting serious disease. So I would take it.
Well, I think vaccine is a good thing because if you look at, for instance, polio and tetanus and those things, it's vaccine that prevent them. So with trial and error, you would get there. So I definitely would take it.
Well, yes, there is absolutely nothing wrong with it. We're definitely sure about that. Yeah, a lot of research has been done in it. There is no problem.
For me, I don't think I would take it. Other people take it, like the Prime Minister who take it and they're okay, they can go ahead.
I will if it's available to me. Yeah, I don't have any qualms or doubts about it because so many millions of people have taken it and we only had a few incidents. But I give it 100%.
Yeah, people talk about the vaccine, they say it looks so nice. I won't take it.
While these individuals clearly stated where they stand as it relates to taking the jab, others were still unsure.
I don't know what I will do yet, but if I had to take it, if I must take it, I will take it. But right for now, I stay neutral.
The point about it is that they're not too sure if the vaccine working. So I'm not too sure if I'm going to take it, right?
I never heard any good information about it. But I'll consider it.
I'm still thinking about it. I still have to think about it. There's still a lot of people don't know. There's still a lot of questions, even about how vaccines are actually made itself. I'm not an expert, so I need to rely on information before I make a decision.
Grenada is expected to receive 6,000 doses of the vaccines on Thursday and over 40,000 over the coming weeks. For GBN News, I am Rina Pear reporting.
So that report fired by the GBN newsroom. And this is Beyond the Headlines. Minister Steele, we want to come back to you to ask you a couple of questions emanating out of that. We'd like Dr. Mitchell to chime in as well. We heard the whole issue of public trust, the need for information, probably some people acting on what they've seen on social media. Let me give you some time to stew on some of the issues that you heard coming out. That we must take a commercial break and come right back with our panel. Stay with us, please.
A great man once fed a multitude with 5 loaves and 2 fish. Imagine what you can do today with a Lotto jackpot. Be in it to win it with the National Lotteries Authority's Lotto jackpot of $80,000. Lotto. Play and win a lot of money.
Well, good evening, viewers and listeners. Welcome back. It's time for the National Lottery Authority's Lotto draw number 3179 for this evening, Monday, the 22nd of February, 2021. The estimated jackpot for this evening is $80,000. Joining me once again is Ms. Makiba Bain. She's representing PKF Accountants and Business Advisors. Well, let's find out what the free ticket letter will be. Good luck. And the free ticket letter is, yes, the free ticket letter for this evening is a lucky letter L, L as in lucky. That's L as in lucky. And it's time to reveal tonight's 5 winning numbers for $80,000. Good luck. All right, check your tickets, check your screen. First number is we've got to recap, so double check your tickets. Let's start with the free ticket letter firstly. That letter was L as in lucky, or L as in lotto. And to recap tonight's 5 winning numbers for $80,000, first number up was 2, that's 0227. second number 333333. The third number 262626. Fourth number was 7077, and the fifth and final 32. That's 3232. If you have these numbers, congratulations to you. This has been Lotto. Play and win a lot. Don't forget to tune in tomorrow. Do get your tickets and continue to support sports culture at Nation Building. Have a good night.
By now, you should know that the early bird catches the worm. So, what are you waiting for? Put wings to your feet and head to your nearest scratch seller. For every quick sevens scratch ticket you buy at $2, the NLA gives you 7 chances at winning as much as $7,000. Scratch the entire play area for your 7 chances at revealing as much sevens and win the corresponding prizes. Win easy with Scratch. Must be 18 or older to play.
How going on, boy? Hey, good old things. Hey, easy. Yeah. Boy, in line, boy. Your house looking a real good day. Boy, it's thanks to the hard-working and professional staff at the Housing Authority of Grenada. They handled me real nice. They did my plan, they did the construction, and I didn't even have to worry about a thing. They were there with me every step of the way, supervising the job, asking me about my concerns, giving me feedback as the house took shape. They were there from start to finish, and even put the keys in the palm of my hand. I give them an A++ for customer service. Oh, it's people from housing bad, boy. Boy, not bad. Excellent. If you're thinking about constructing your home, why not consult the Housing Authority of Grenada? You could visit them right down in the Sandino complex, or give them a call, 440-1015 or 440-1016. Or check out their website, hag473.com. They go handle you. They go jog your blocks, they go draw your plan, they go tote your materials. Hey man, where you going? The Housing Authority of Grenada is your choice for affordable housing and a stress-free construction experience.
Peace of mind comes from knowing that your family is safe and financially secure. For your peace of mind and theirs, plan ahead. Beacon's Rest Easy policy helps you to do just that. Rest Easy is a policy that offers you a payment upon your death or the death of any covered family member that can be used to offset post-mortem expenses. For as little as 75 cents per day, you can ensure that your expenses are covered. Call Beacon at 440-4447 and sign up for the Rest Easy plan today.
Every action we take impacts the lives of others around us. The Grenneck Community Partnership Initiative, GCPI, has been working with Grenadian organizations to impact communities directly. Giving back to communities we serve is fundamental to the way we do business. And every year, more lives are touched across Grenada, Carriacou, and Petite Martinique. In education, sports, health, infrastructure, social services, and beyond.
Ultratech gasoline and diesel, available only at Rubis stations.
Do you know what time it is? You guessed right, it's detox time again. At Nirvana Natural Health Clinic, Detox Center and Natural Health Store. Purchase our 7-day cleansing pack for only $500. Includes everything you need for a complete total body cleanse. Cleanse your blood, kidney, liver, and colon. This cleanse will help you lighten up and get rid of the excess. Also available are our special product Detox Combo Pack for only $100. Try our single detox products starting from $40. Check us out now. Belmont St. George's, close to the Fall Edge area, or call us on 231-6642, 449-7753, or 418-7115. Nirvana Natural Health Clinic, Detox Center, and Natural Health Store. Detox, your way to health.
Welcome back to Beyond the Headlines. This evening, we're looking at COVID-19 vaccination. And we have with us, if you join the state, we have the Minister for Health, the Honorable Nickolas Steele, the Chief Medical Officer, Dr. Shawn Charles, and Dr. George Mitchell of the COVID-19 Committee. So we did show a video excerpt of members of the public giving their perspective on the vaccination process. What are your thoughts on the feedback that we received, Mr. Minister?
Well, Odette, I would take that as a very independent sampling, unofficial sampling done by your media house. And I was pleasantly surprised with it because I saw a segment that said maybe 20% of them that said, yes, they're ready to take it. I saw the largest portion of the individuals that you spoke to saying they're considering, but they want some more information or they want to see other people take it first. And then I saw a small portion of them say, no, I'm not taking it. And that is a favorable position to be in. We've started the vaccine rollout. We're here tonight to speak about vaccine, and we are going to be providing more and more information on the vaccine for those who are requesting more information, those who are slightly skeptical, are leaning towards or are prepared to once they have more information. And not just us, but mainstream media as a whole, not just here in Grenada, not just in the region, but internationally. Every single country in the world is beginning or working feverishly to begin a vaccination rollout. So the information for those who are requiring more information will be forthcoming. The willing are the willing, and they are showing up to get the vaccine. And the hope is that the individuals who still remain skeptical or who have adopted a position from day one that they're not going to take it, that they will eventually, and if not, that with the rest of us taking it, and quite likely there are individuals that will never have to or never want to travel in the next couple of years or so may never need that vaccine. If an individual fits ideally in that position, then quite likely they can opt out of not taking the vaccine and never feel the need to take the vaccine because the rest of us would have.
Minister Steele, did you have any side effects when you took the job, and did you get any feedback from the Prime Minister on what his experience was like?
For me, I had no side effects, and I kept looking and expecting side effects. Prime Minister had almost none. He said he felt a bit tired the following day. We did have some members of our team that took the vaccine on that same Friday that did feel flu-like symptoms, had minor fever or so. But everybody is back up and running, and a week and some has passed. So we're well on the way to that first dose expectation of 60% protection.
So I have some feedback from someone in the U.S. who reported, she said, I took my 2 doses already. The second dose, I had a fever and aches that lasted a few hours. Once I took Tylenol, it was gone. Less than 24 hours. The first dose, no side effects. She said another person had slight aches and minimal pain in her arm. Another person had headaches and aches that didn't last more than a day. They all had their 2 doses. It's just like any other vaccine. Dr. Charles, I suppose that you got your jab already. What's your experience has been like?
Well, I took my jab on the first day. With the other officials, and by nightfall I had a slight headache. That headache continued during the night. I felt some chills and a little feverish, but by the time I woke up the next morning, it was gone, and I was fine the next day. So it wasn't anything spectacular to speak about, and here I am today.
Okay. Dr. Mitchell, what was your experience like?
I'm happy that you left the best for last, actually, Odette. Because I did not feel absolutely anything. I don't know if it's a state of mind or if it's just the vaccine as it presents with different people. that some people feel a little thing and some people don't. But I had absolutely no problem at all. Or maybe I was so optimistic about it that I could not feel. So sometimes, it's your state of mind. So I had my job, I had my normal Friday evening. I woke up on Saturday morning. I actually did about 45 minutes of exercising, and I was good to go Saturday, Sunday, and the rest of the week. So for me, it was a really positive experience. Even questioning myself, did this thing actually work for me? But as it is, and as we were telling persons today at Radisson, some people do get side effects. Some people get none. Some people get, one, maybe two of the headache, the fever, maybe a little chill, maybe a little ache. But that is normal of receiving a vaccine. And it was really, really, really a pleasant experience because persons today understood that a vaccine does do that kind of thing, give you a little side effect. And so it worked out to be really well to give you a short answer, because I can give you a very long answer.
Thanks for the short answer, because already we noticed we're running out of time. And we have a couple of questions for Dr. Charles. One person is asking, what is the vaccine made of? And if there's none or no trace of the virus in the vaccine, what is it made of? Dr. Charles?
Right. So the vaccine, it's a particular technology called a viral vector. So a viral vector is used, and a vector is something that carries something. So this viral vector is used. It carries some genetic material of the COVID virus that codes for the spike protein. So it carries that to your cell. Your cell uses that genetic material, makes the spike protein, and presents it to your immune system. Your immune system recognizes it and builds immunity, so that if you come in contact with the real thing, then your body already is primed and make antibodies and so on to defend against it.
Okay, so somebody else asked, I think you have answered the first part. The person is asking, I think what people need to know is the content of the vaccine, which you probably just addressed, and they're asking for statistics on the percentage of incidence, and why is it not used in persons over the age of 65?
I am not sure what is meant by percentage of incidence of COVID, or I'm not sure what is meant by that.
Okay, so
there was some questions with regards to persons over 65, but those were answered when WHO and the European Medicines Agencies and the UK regulators all approved this vaccine for use in persons over the age of 18, including over the age of 65.
So, in terms of, have you had any information on probably looking at side effects and when they talk about incidents? So, for instance, we saw a report where the CDC and Mr. Minister, let me make sure that I declare my source, the Center for Disease Control in the U.S., 501 deaths plus 10,748 other injuries reported following COVID vaccine. That's according to the latest CDC data. Let me clear that up, that was up until January. The numbers reflect the latest data available as of January 29 from the CDC's Vaccine Adverse Event Reporting System website. Of the 501 reported deaths, 453 were from the U.S. The average age of those who died was 77. The youngest was 23.
So maybe I can tackle this one.
Sure.
So this vaccine, the adverse reporting system, is an online system where anyone can report. Now, yes, these are reports, but I can tell you that so far, none of these deaths were found to be directly attributable to the vaccines. Many of these deaths occurred in elderly individuals following vaccination, but not necessarily due or a consequence of the vaccine, these were elderly persons with underlying health issues that would have succumbed to due to other issues and not related to the vaccine per se. So yes, those reports were made, but upon thorough investigation, they have not been attributed to the vaccine, or they were not deemed to be caused by the vaccine.
Let's clarify.
Mind you, the vaccines that are available in the US are Moderna and Pfizer.
So let me just take 30 seconds here. 30 seconds here, if you don't mind. Because I think the first part of the question was addressed to the minister. I've been telling people and sort of like making people smile, even today at Radisson at the vaccination center, that if you're going to collapse anyway from anything else, don't go take the vaccine and collapse and then blame it on the vaccine. And this goes for sure. Some persons are sort of destined to have an issue. They have an issue, and you would blame it on the vaccine. And as I said in an interview last week, I know of a particular person who should have had the vaccine, did not have the vaccine, but ended up in hospital. And if, God forbid, she had the vaccine and ended up, it would have said that it was the vaccine that, caused the problem. So we have those sort of like coincidences that happens all the time. And so we have to be extremely careful with that. So I actually would hand back to the Minister.
Yes,
sorry.
Let me add to that.
Minister, one second. Let me just go back. Minister, let me just go back to Dr. Charles for a point of clarity here, because I want to be certain that we don't mislead people. And I'm asking for my knowledge as well. So can you clarify for me, Dr. Charles, the comment you made that it was not necessarily attributable to the vaccine. So the information that I have here says the Pfizer vaccine was taken by 59% of those who died, while the Moderna vaccine was taken by 41%. So are you saying that you are acknowledging that these people who died were vaccinated, but you say that they did not necessarily die as a result of?
Yes, and that is exactly what I'm saying.
Okay.
Yes.
All right.
They were vaccinated, and yes, they died, but the vaccine was not proven to be the cause of their death.
Great. Thank you so much for the clarification.
Yeah,
Minister, go ahead.
Let me add to that point that Dr. Charles has just made. What the CDC has been doing with many people that received the vaccine is that they have been checking in on them consistently since receiving the vaccine so that they can log this information. And they've been totally transparent, like all governments have been, or most governments have been, with respect to the vaccine, as we have been with respect to COVID-19. Now, 28 million people in the United States were infected to date by COVID-19, and 500,000 died from COVID-19. Clinically determined, not argued. 500,000 have died from 28 million infections in the US alone. The US to date has vaccinated 68 million of their citizens. Almost, they are approaching 3 times as many people vaccinated than were infected. Even if, as Dr. Charles is saying, and I agree with him, that those 500 are not attributable to the vaccine. Even if they were, what you're talking about is a 0.00005% of individual that had adverse effects or died from the vaccine. Whereas in 28 million, 500,000 have died. So I think most definitely that there are a lot of figures being thrown around, but we need to focus on the main figure. The number of people that have died after contracting COVID-19 and the number of people that have died, if any, as a direct result of the COVID-19 vaccine. And that is what we stick with. Similarly, figures coming out of the UK as well, they're in the tens of millions of people. And there still is not one death attributable. There are alleged and there are stories and there are implications. What we got to remember is the vaccine is going to give your body the ability to fight COVID-19. The vaccine does not give you immortality. There is the possibility of somebody dying after receiving the vaccine, but not from the vaccine.
So, Mr. Minister, if you were campaigning to be the next leader of the WHO, on that quote alone, I'd elect you. You've got my vote, Mr. Minister.
No. Odette, I love it as well. I looked at him and I'm saying, wow, okay. Does it give you immortality? This is a very striking statement.
I would remember that quote tomorrow. Dr. Charles, somebody has a question. They said we're giving out the vaccines. If a person has COVID-19, but they're not aware, but they are given the vaccine, will that complicate it?
No, it will not. It may have no effect at all. Right? Because if they already have the infection, the body would have already started building an immune response to the virus itself, similar to what the vaccine is trying to trigger. So there may not be any noticeable effect at all.
Okay. Now we need to go to some rapid fire questions because we're coming up on 9 minutes to 10 o'clock. So I'm going to ask us to keep answers brief. And we have some unrelated vaccination questions. I don't know who will take this, but somebody's asking, a question for the Ministry of Health. Why is it that persons returning or visiting Grenada have to pay $405 for a PCR test and wait 48 hours for the result? This is too much for a small island like Grenada, and waiting time in quarantine is costly. I can understand 24 hours, but not 48.
Well, simply put, Odette, it is, as a person said, a small island like Grenada, and we need to be sure. And with the resources we have, we want to make sure that persons are tested properly, and the persons are being tested by human beings. And the human beings work at a certain pace to make sure that they don't make any mistakes at all. And the lab results do take time to make sure that the lab results are accurate.
Okay,
I spend a lot of time with the lab people as well, and they are working as fast as they can.
Rapid fire assistance additions here. In a lot of countries in the world, the test, you can't get it in 48 hours, you can't get it in 72 hours, you can't get it in many more hours.
Okay. Mr. Minister, let me go to a quick question. We had a surge, that's not a proper word. It's failing me at this time. We had a spike in cases in December.
A cluster. We had a cluster in December.
At Sandals. And we have seen reports where Sandals is preparing to reopen in Grenada and the other Caribbean countries. Can you give us a quick status report on that? True, false, yes, no, will open, new protocols, new guidelines?
We are looking to reopen our borders. We have been always aiming to find a safe way to conduct the economic activity. I have consistently said the balance between lives and livelihoods. We've had people come in quarantine and breach quarantine. We didn't use that as an excuse to just close off and not let anybody else come in. We strengthened our procedures and protocols to make sure as best as possible it wouldn't happen again and to protect. In the same way, within the hospitality sector, if there have been any areas that we have discovered to be areas of weakness or areas that can be strengthened, we will do so. We will work together with all of our stakeholders to find a way to reopen Grenada as safely as possible, as quickly as possible.
So, Mr. Minister, you just gave me the Barack Obama answer. You're really scoring political points tonight, let me say, right? So you just gave me the Barack Obama answer. I would like to have the Joe Biden answer to that. Is Sandals reopening here anytime soon?
I do hope so, because Sandals provides an essential role, as do all of our hotels in Grenada. And we have individuals who depend on that level, that income from Sandals, and we have an obligation as Ministry of Health to find a way to safely do so.
Nicodemus visiting at night is a shade that was thrown at Grenada. And do you think Nicodemus is visiting St. Vincent and the Grenadines right now?
I think certain statements that were made were regrettable. And I think having said so, I'm not about to make any critical statements. Our thoughts and prayers remain with all of our neighbors, the people of St. Vincent and the Grenadines, the people of St. Lucia, the people of Barbados, the people of Trinidad, the people throughout the world in countries where there is right now community spread of COVID-19. We cannot take it for granted, and we have to look and learn from them and all the mistakes that they have made. In the same way, when we make mistakes, they look and learn from us. So I'm not going to make any statements about what's going on in St. Vincent, except to say they're in our thoughts and prayers, and wherever we can assist, we will assist.
And what about the Russian Sputnik vaccine that the Prime Minister St. Vincent accessed rather than probably Moderna, Pfizer, AstraZeneca?
We are sticking to a principle that we have said from the beginning once a conversation about vaccines came up. We will look at a vaccine that is approved by the WHO, Pan American Health Organization, the CDC, Public Health Canada, UK, or European Union. The vaccine Sputnik is, by all appearances, soon to be approved by some of those entities, and therefore at that point we would look at it. I do believe that doing it before is premature, but we're all in different circumstances in each of our islands and have to make different decisions.
Okay, great. Dr. Charles, you wanted to chime in on something. Go ahead.
Yeah, I wanted to chime in on that issue with our neighbors. Remember, if one of us is not safe, all of us are not safe. So I think we are all in this small OECS boat, in this boat of the Americas together, and we must all, we have to wish the best for all of us, or we wish the best for all of our neighbors as they all struggle with this pandemic.
Okay, great. So we are going on to 30 seconds closing comments. Mr. Minister, we're not going beyond 10 o'clock tonight. So I'm going to start with Dr. Mitchell. You have your 30 seconds closing comments.
Yeah. Thank you, Odette. I was waiting for that. I cannot but, encourage everyone listening out there to take the vaccine. I think the arsenal, the weapon we need to get back to where we were before, and together with the other measures that we have advocated. And so, I look forward to everyone out there, despite their reservations. And I know people have reservations, and people are, it's okay to have reservations because this is new. But in my world and in the real world, it is the best thing to do at the moment. So I really, really strongly advocate that persons do take the vaccine so that we can get back to normal. And of course, as per usual, kudos to the staff, front-end workers, everyone. And, let's be safe and let's keep Grenada flag flying where it is at the moment.
Mr. Minister, as we go to you for your closing comments, I just have to let you know, someone is saying on social media, the minister is worth his salt. He's not just another pretty face.
Even with the mask on, right?
Even with the mask on. So, Mr. Minister, your closing comments today?
My closing comment on that is that, first and foremost, let me take as much time as possible to recognize the team that is carrying out the vaccination that started 2 Fridays ago and continue. These are the same individuals that have also been swabbing and testing individuals that have been going on 7 days a week since March, since the first threat of COVID appeared. So I really want to give them their due recognition, that entire team. That what I wanted to say simply is that there are questions that have come up with respect to what's the cost of the vaccine. The cost of the vaccine to date is being supported by the donor countries that have offered us and our contributions previously to Pan American Health Organization, as well as the WHO. That is not going to take us much further. We are going to have to purchase, and we are prepared to, and we have expressed, and we are ready to, within days, to purchase the additional vaccines. That cost is going to be in the millions, yes, and that's taxpayers' dollars. But to those who are asking what the cost is, it confuses me on that, because I will ask them a different question. Can we afford not to vaccinate our population? Can we afford, from a taxpayer standpoint, from a government standpoint, from a people standpoint, to remain the way we are right now? No carnival, no large gatherings. We can't have the weddings that we would like to have. We can't party. We have many businesses struggling to survive. We have individuals that have not received a salary since March of last year, 2020.
Mr. Minister, can I beg?
Can we afford to continue this?
Can I beg a deferral?
And if the vaccine is the solution that every single nation in the world, every single, I'm yet to hear a single nation say that I am going to get past COVID by not vaccinating my population.
Okay, great. So, Mr. Minister, your closing sentence is, because I'm certain we have to defer this parliamentary sitting and continue debate on this bill. You're going into that bill, Mr. Minister.
I just want to say I'm looking forward to, and I ask individuals, those who do their regular checking on social media and follow all different articles, I am looking forward to, and I'm willing to go on record now, statements being made by entities like the CDC, by the European Health, by UK and Canada, that being vaccinated not only protects you from severe symptoms, but very soon I expect to see statements coming out that being vaccinated will prevent you from being able to spread, or will mean that you do not have to spend the type of quarantine period and isolation period that we've had to succumb ourselves to. Those that I'm looking forward to within the weeks. And I think that will be the final bit of information that those who may be skeptical right now are rightfully looking to see. And I'm confident that information will come out, not by us, but by mainstream international media and other independent countries.
Thank you so much, Mr. Minister. And let me just say that I tip my hat to you. When we were last on, I asked you what time frame you expected the vaccines to get to Grenada. You said in the first quarter, and I have to tell you that silently, I was like, I didn't expect it to happen, so I congratulate you. Dr. Charles, you have the last...
You and another person, you and another media personality went on, well, at least you didn't go on record, but somebody else went on record, and I am holding true to my word.
So just let me ask you quickly, where are media people in the pecking order in terms of getting the vaccine? Can media people access theirs this week as well?
Odette, I think that's a reasonable question. And I would be most willing to find a way for media persons, because they are seen as frontline workers from the point of view when we have a state of emergency, when we have lockdown, etc. We have everybody, the media persons are entitled to circulate and report. And I would like media persons to get the vaccine if possible this week. I will have discussions with Dr. Charles and the team so that media persons can report on receiving the vaccine and tell the nation their experience after getting the vaccine, apart from the fact that you will be protected.
Great. So, Dr. Charles, the closing words tonight belong to you.
All right. So, in closing, well, firstly, I would like to recognize the team from Community Health that has been at the forefront of this COVID response from the start with testing, and now they are leading the charge with vaccinating the population. They are very hard workers. They are very disciplined workers. And I would just like to recognize them for this. I want to encourage, I feel encouraged, by the uptake in the vaccines that we have seen in the past days. It means that the misinformation campaign, the active misinformation campaign that has been orchestrated throughout social media and sometimes even in mainstream media, that misinformation campaign is losing ground. I want to ask Grenadians to continue to spread the truth about vaccines and stop listening to a lot of the propaganda. For us to get back to normal, we need to be immune against COVID-19. For us to return to some semblance of normality, we need immunity, and it would be better to get immunity from a vaccine than to get it from widespread infection from COVID. So I want to encourage everyone to take the vaccine. When it's your turn, take the opportunity and get the vaccine. Continue following the protocols. Continue working along with the Ministry of Health as we deal with this pandemic. Thank you.
Thank you very much. And just one quick question before you run off, Dr. Charles. When you get to the point where you would charge for it, do you have an idea how much it will cost per person?
The thing is, I don't have because we have not had discussions on whether vaccines would be offered at a cost or not. We are not there yet. We know that the state will have to invest quite a large sum of money, as Minister said, to purchase additional vaccines, but we are not there yet with regards to discussing persons paying to access the vaccine.
Thank you very much.
Let me say, Odette, there is absolutely no discussion or consideration right now for charging Grenadian citizens for the vaccine.
Okay.
There has been requests from various sectors to help to contribute to that.
Okay.
But there will be no charge to Grenadian citizens for the vaccine.
Great. So thank you very much, members of the panel. We'd like to thank the Honorable Minister Steele. We'd also like to thank the Chief Medical Officer, Dr. Shawn Charles, and member of the COVID-19 Committee, Dr. George Mitchell. Thank you, gentlemen, so much for enlightening us. This has been very stimulating, and you have clarified a lot of points that people had going through their minds. And to you, members of the public, those of you who follow the program online, on GBN television, and via the social media platforms on www.gbn.gd, on behalf of the entire production crew here at the Grenada Broadcasting Network, I'm Odette Campbell saying we'll see you again next Monday for another edition of Beyond the Headlines. Hopefully next week we'll get to St. David, where there is some controversy over a hospitality sector project that is generating a lot of interest. And we understand that there was some form of action and gathering in the area last week. I don't know if Minister Steele might want to come back to talk about the need to balance livelihoods and the other L. We'll see how that goes. I'm only just teasing the minister there. We'll see you again next week. Let's see how that pans out. Have a great week, everybody. And those of you who have to go and get the vaccine, it's your opportunity. Go and get the vaccine. If you're still undecided, that's your prerogative, but the people who it is open to this week and you have the opportunity, you'd like to access the vaccines, it's being offered at the Radisson, and that's for frontline workers and taxi operators for the time being. So long for now. We'll see you again next week, Monday.